Elcomed traditionally has used a single clinical notes file per patient. It is a basic text file. This is fine for single clinician practices, but is not ideal for practices where multiple clinicians want to keep notes for the same patient. For this reason, Elcomed has developed an advanced clinical notes feature, which can be switched on to replace the traditional clinical notes. It should be noted that when switched over, all clinical notes will still be viewable within the advanced clinical notes and nothing will be lost. In time, the old simple clinical notes will be deprecated. New clients automatically only have the new advanced notes. For existing customers, please contact Elcomed or your reseller to have the new feature enabled. With the new clinical notes feature in place, you will now see all files in chronological order with the oldest at the bottom and the newest at the top. Clinical notes are now stored as individual events against the user that created the note and the date and time that the note was created. Only the clinician that created a note may edit it. Besides this improvement on clinical notes taking, a few other elements have been introduced. Namely, the notes now support Markdown format, which is a text format that allows basic formatting to be done using certain symbols. Formatting options include headers, bolding of text, bullets, numbered lists and tables, as well as a few other formatters. For a full list, see the Guide to Markdown under the Learning Center module. Here you can see an example of adding a clinical note using Markdown symbols. Clicking on the Preview Formatted button will allow you preview the formatted notes as they're entered. Note that if no Markdown symbols are used, the preview and the resultant Markdown will just be an exact preview of the raw text. Another major feature added to the Advanced Clinical Notes module is the interleaving of files and forms from the patient's timeline interleaved chronologically with the clinical notes. This includes forms, questionnaires, operation forms, scripts, sick notes, radiology reports, X-rays, scans, and any other file that is accessible via the traditional timeline. This gives a clinician a much better way of viewing the full history of the patient along with all other artifacts. By default, when a patient is opened or selected, all the clinical notes taken for that patient will open automatically. Other files, however, will be listed interleaved with the notes, with their names, but will need to be clicked on to be opened. This is to eliminate unnecessary load against the Elcomed servers to keep in line with our ethos of a super-fast user experience. Any file that is opened within the clinical notes, such as an image file or an HTML file, a text file, can be edited right there within the clinical notes module. Files that cannot be edited, such as PDF, will just be viewable. The shortcut key feature, as is available in the traditional clinical notes, remains available, as do all the AI tools. There is also sorting and filtering options. By default, files are shown with most recent at the top. Clicking on the sort icon reverses the order. Clicking on the filter option filters out all files and forms and displays only all the clinical note files. If a clinician needs to correct mistakes in previously created clinical notes, they can click on the unlock icon on the right above the note. This will unlock that note for editing. Only the user that created a note is able to unlock and edit it. Some of the advantages and features of advanced clinical notes. Multiple clinician practices can work on the same clinical notes with unique edit and update timestamps. Only users who created a note can edit a note. Markdown formatting, allowing more professional formatted notes. All items from the patient's timeline appear in the advanced clinical notes in chronological order and can be edited right there.